Hello, dear listeners. Welcome to another episode of Follow Your Path. My name is Abdul Abid, and I'm a surgical pathology fellow at University of Pittsburgh Medical Center. And today we will be talking to Dr. Andrew Bellizzi. He is a clinical professor of pathology and director of GI pathology at the University of Iowa. I'm also joined today by a future pathologist, Virginia Fernandez. Welcome to the show, Dr. Bellizzi.
It's an honor and a privilege to be here. Nice to chat with you guys.
So, starting off, can you please tell us a little bit about yourself, where you grew up, where you went to medical school, residency, and how did you end up doing GI pathology?
Sure. Yeah, I'm practiced. I was interviewing for our residency program this morning, so I gave the spiel a couple times already today. I'm from Central Connecticut. I was born in Hartford, Connecticut, at Hartford Hospital, and I grew up in Newington, Connecticut, which is just the next town over. I was born Catholic, baptized and such, and I went to Notre Dame for undergrad, and I'm a big Notre Dame fan, and I root for the Irish football team and basketball team, and I'm often found sporting this chapeau. Um, at Notre Dame, I met a girl in the church choir freshman year, and we got married shortly after graduation. And she was from Chicago, and that drew me to Chicago for medical school. I went to Northwestern. I didn't come from a medical background. There were a few doctors in the family, but not anybody that I was especially close with. So I was finding my own path. When I started medical school, I thought I was going to be family medicine. I was attracted to having a really broad working knowledge, and I was also attracted to being really effective. And I had this dream of being able to take care of an entire community. Summer between first and second year of medical school, I spent the summer working with the family medicine doctor, and unfortunately, I found it incredibly disappointing. I think that my life could have been very different if I had interacted with a different mentor. I saw him very frustrated in his work. He was relatively ill paid for the amount of hours that he was putting in. The diseases that we saw in the clinic were diseases of Western civilization, things like diabetes and complications of smoking, and the advice that he offered his patients generally wasn't heeded, and it seemed like set up for a long, frustrating career. When I was an undergrad, I didn't have this medical background, but I had a bunch of friends who had moms and dads that were physicians, and they were mostly internists because most docs are internists, and they were mostly frustrated. I didn't bump into any potential role models in undergrad who were really self-satisfied physicians. When I was when I was a first year medical student, I was incredibly gifted at histology. I took to it right away, and I loved it, and I thought it was fascinating. And I often say I'm a structure function guy. That was actually the name of our integrated first year biomedical course at Northwestern, where I went to med school, structure function. And so the idea that I could look through the microscope and see the cell, and how that correlated to what the cell was evolved to do was I continue to be blown away to this day by the magistry of the human body at the microscopic level. So so after that time between first and second year, I was forlorn, a little lost, but everybody told me I was going to be fine because even when I was a first year, all my friends who saw me enjoying histology so much said, "Oh, you're going to be a pathologist." But I had never even heard of a pathologist. I guess I had, right? I was familiar with Quincy, and then more contemporary CSI was very popular when I was in medical school, and I didn't want to be a forensic pathologist, and I didn't have any understanding of what diagnostic surgical pathology was. But I went back to second year, and the lectures that I was hearing, our integrated curriculum, they were mainly pathology lectures in the summer. The pathologists really had the lion's share of the hours of instruction in the first few months of the second year curriculum. And this guy, Janardin Reddy, he was the chair of pathology at Northwestern. He was an incredibly charismatic speaker, and he hooked me. And then the other event that was like a religious event for me was getting robins, and I can see it on my bookshelf there, robins, and I remember sitting at the kitchen table and opening it up for the first time and reading the foreword and being taken in, and then starting to read the first chapter, and I couldn't put it away. And the combination of those lectures, especially Dr. Reddy, and that book drew me in, and I immediately sought out additional exposure to pathology. Started emailing pathologists. I had pathology-based small groups, so I had some contacts that I leveraged and started going to conferences. There was, I recall, an autopsy gross conference that I would attend every week all through second year. And then I was so interested in pathology that in my third year, when uh, medical students would normally only have the opportunity to rotate in pathology as an elective as a fourth year, I reorganized my sorry about that. I reorganized my schedule so that in the second rotation of my third year, um, in lieu of family medicine, a specialty that I had eliminated in that summer, I spent a month in pathology. And so I did my first pathology elective in August of my third year of medical school. And after that month, I knew that I wanted to be a pathologist. I had a great mentor named John Warren, who was a medical microbiologist, and he took a lot of interest in me. And as a fourth year, I actually did a elective rotation in medical microbiology with him. And so when I was going into residency, I definitely wanted to do anatomic and clinical pathology, and I was definitely interested in surgical pathology, but I was broadly interested in all of pathology, and I thought it was possible that I would end up as a medical microbiologist. And then I got to residency, um, and I ended up doing APCP at the University of Virginia. I thought I was going to do residency at Northwestern. That's where I fell in love with pathology, and I think I definitely could have, and I would have had a great time. But I was taken by Charlottesville, and at the time, my wife, now my ex-wife, and I were really itching to start a family, and we had lived in Chicago during medical school, and it was difficult because it was so expensive, and we were just scraping by. And so when the opportunity to train in a place where we could each have our own car and buy our own place, we couldn't pass that up, and it seemed like an ideal place to start our family. So I ended up at the University of Virginia, but there were a ton of places that I loved. Actually, my second choice residency was the University of Iowa, which, I'll let you guys ask another question. I'm not going to talk for the whole 50 minutes. Um, so I ended up in Charlottesville, and then Abdul asked how did I come to GI? And I came to GI a lot of different ways, but one of the things uh, I told you that I was initially interested in family medicine because I wanted to command a really vast body of knowledge and apply it in a really meaningful way. And when I started doing pathology, and I related that I had interest in anatomic and clinical pathology, I gravitated towards surgical pathology because I'm a I'm a I'm a doer. I'm an active agent. I would rather do it than oversee it. And of course, we have both of those sides in each of us. And I do a lot of oversight, right? I'm an immunohistochemistry director. I don't actually load the auto stainer myself. So I gravitated towards surgical pathology, and I found the diagnosis at the light microscope to be incredibly compelling and satisfying. I knew I wanted to do academic pathology. I knew I wanted to do academic medicine. I think another, super core value is, I've always been a teacher, from the time I was a little boy. And so I knew going into medicine that I wanted to teach. And then I went into medicine to teach. I went into pathology to teach. I gravitated towards surgical pathology, and I chose GI pathology because, like family medicine, I perceived that among surgical subspecialties that it was the most vast, because we've got a rich array of diseases that are both inflammatory and neoplastic. Most of the other subspecialties are mostly just neoplastic. So we've got inflammations and neoplasias, and there's tubal gut, and there's liver and pancreas. And I didn't want to subspecialize. So if I had to subspecialize, and I knew that I had to subspecialize, I wanted to choose the I wanted to choose the biggest subspecialty. And there were lots of other reasons I gravitated toward GI pathology as well. Mentorship, right? So Chris Moskalik, he's the chair of pathology at UVA right now, but he was a GI pathologist. He was physician scientist. He was the only fellowship trained GI pathologist in our department at the time. And his pedagogy, the way that he taught, it made so much sense to me. It clicked with me, and I think that was important. Ed Stilo was a junior faculty, and he's a cytologist, but he was very, very interested in GI, and so we did a lot of work together in cytology, in GI, in cytology. So I think those two mentors were core. Uh, I liked the GI. I went to the meetings and I liked the GI pathologists the most. They seemed like it was a big group and it was a fun group. And Henry Appleman really stands out as someone that I thought was brilliant and hilarious. And I mean, I'm embarrassed to say it because I pale in comparison, but I've modeled my career to some extent after him, in the sense that I admire that he's genuinely Henry, 24/7, 365. That there's no artifice there. That what he presents, like he doesn't leave the microscope and become a different person. And so Andrew's Andrew at the microscope, in the hallway, in the cafeteria, and at home. And I also admired his unique point of view, and I admired the fact that he got to know who I was when I was a second year resident presenting my first poster, and all those things were deeply impactful. And I model the way that I interact with folks like you guys after how Henry interacted with me when I was a baby resident. And then the other person that deserves a big shout out in terms of influencing my career was Liz Montgomery,
Mm.
reading her biopsy book when I was like a second year resident or first or second year resident. I read that book and it made sense. And I read all those books, and that was the one book that made sense. And I don't know if it was the way that Liz wrote or the way that folks like Henry and Bob Riddell had figured out how to correlate what they were seeing in these endoscopic mucosal biopsies with the presentation of disease, this systematic approach to diagnosis that Liz was channeling through her writing. But I guess I would say advice to anybody is, if you have a choice between something pursuing something that you're interested in and that you find to come naturally and be kind of easy versus something that you're not interested in and is incredibly difficult, that you probably should apply your efforts toward the former. So that's what brought me to GI pathology. I applied for fellowship, and I applied mainly in the Midwest. We had done our time on the East Coast and wanted to get Sarah back toward Chicago, closer to her family. And we were expecting when I was graduating from residency. I did my fellowship at Ohio State with Wendy Frankel, who was another great influence, like a mentor and sponsor. She's always fiercely advocated for me and sort of plowed the field in front of me, and given me opportunities to shine. I was a junior faculty at Brigham and Women's Hospital. I worked there for a little over 2 years, where I was deeply influenced by Jason Hornick and Chris Fletcher, mainly, but by lots of other folks as well. And I'm a GI pathologist, and Abdul, he asked me to come on here and talk about GI pathology, but I'm also an immunohistochemist, and I say I'm an immunohistochemist first. I say GI pathology is what I do to pay the bills. It's what the department hired me to do, is sign out a bunch of cases, but immunohistochemistry is my passion. And I talk too much, so I could talk for a half an hour about my path toward and in immunohistochemistry. But I will say at Brigham, working with Jason, who's another master immunohistochemist, that really further fueled my enthusiasm and abilities in immunohistochemistry. I came to Iowa in 2011, Halloween 2011. So I just had my 11-year anniversary, and I mostly do what I want to do. The department's general, but I subspecialized GI pathology with one other pathologist in January 2014. We started a fellowship shortly thereafter. We just recruited our 8th fellow. I've been the director of the immunohistochemistry lab since July 2013, so I think 6 months before we had subspecialized GI. And I mainly sign out GI pathology. About 90% of my service weeks are in GI pathology, and run the immunohistochemistry lab. And we went from 2 GI pathologists to 1 for a brief period, when the person that I co-founded the service with took a job in private, to 3 for many years. We were stable at 3. But actually, when my fellow from this year, Matt Gossi, joins our faculty in July, will be 8. And so that's the story from birth at Hartford Hospital to working with a tremendous group of talented GI pathologists at the University of Iowa hospitals and clinics.
Oh wow.
Can
Yeah.
you share with us a case that you have found the most interesting in your career?
Boy, that's a really great question. So there are so many memorable cases. One thing I'll say is that when I make a mistake, it really sticks with me. The other thing I'll say is the thing that's interesting about GI pathology is there are so many memorable cases. 99% of the cases are routine, or maybe even 99.5% of the cases are routine, but but GI pathology is so vast that every couple days and at least once a week, I bump into a case where I say, oh, it's one of these, I see this every year. Or, oh, it's one of these, I see this every 2 or 3 years. Or, oh, it's one of these, I've seen this 2 or 3 times in my career. So I still get excited. I think the things that get me the most excited because they're instant pattern recognitions, you don't have to work through them, are GI infectious diseases. So I still get excited when I diagnose Giardia, for example, or intestinal spirochetosis, or MAI, or adenovirus, et cetera, et cetera. And then I really enjoy oncopathology, and I enjoy, and that's where I really use my immunohistochemistry chops. I like working through what I've developed algorithmic approaches to tumor diagnosis using immunohistochemistry, and I like the challenge of working through the cases in a stepwise manner. I call it, playing chess with the case. And my goal is to always solve the case, with the most specific diagnosis as possible in as few moves as possible. So I love solving a hard case, where maybe I can do 5 or 7 or 10 IHC when somebody else might do 30 or 40 and not be able to figure it out. So just every case.
So what is now that
That's
you're
fair.
yeah,
Mhm.
now that you've talked about your algorithm, and I've read the paper that you wrote, among other IHC papers, but one of the papers as to like unknown primary of unknown origin paper, how to solve that. So what is your favorite IHC stain?
Ha,
What is your favorite IHC stain?
that's a good one. I'm the chair that, and actually we're headed to Tucson, and it's my last meeting. The chair of the College of American Pathologists Immunohistochemistry Committee, and the chairs do 4 years. So I was on for 6 years and have been chair for 4 years. And when I chaired my first meeting 4 years ago, uh, I wanted an icebreaker question, and we were meeting in collaboration with the surgical pathology committee, and Aaron Auerbach is the chair of the Surge Path committee, and we sort of workshopped this the night before, and we wanted an icebreaker question, and the icebreaker question that I came up with for the group is, what's your favorite stain? And actually, I have a list of everybody's responses, and and I host a lot of talks, and a lot of the folks that was in the room with that day, uh, meeting with IHC and Search Path committees, are folks that I've had give talks on my behalf, like at the university, or in something called ISOM, International Society for Immunohistochemistry and Molecular Morphology webinar series, or when I go off and give a talk, and somebody who's invited me was somebody that was in the room this that day. So for David Rim, is like a world expert in biomarkers, and sort of the biochemistry of immunohistochemistry and how that impacts biomarker readout interpretation. I had David give the ISOM webinar lecture a couple months ago, and I had recalled that David's favorite immunohistochemical stain was, he said, anything that's fluorescent and multiplexed, which reflects his background and his interests. And I'm a silly guy, and let me know if you guys can figure this out. I'll give you a second. But this is a stain that I had done research on several years before. It's a urea cycle enzyme. I was looking to develop novel hepatocellular differentiation markers, and had the observation that two of the most famous hepatocellular differentiation markers are HepPAR1 and arginase 1. And HepPAR1 actually stands for hepatocyte paraffin 1, and the actual protein that it recognizes is carbamoyl phosphate synthetase 1. And so this CPS1 and arginase 1 are urea cycle enzymes. And I said, well, what about all the other urea cycle enzymes? And so I made tests for all the other urea cycle enzymes. And one of the urea cycle enzymes is argininosuccinate synthetase 1. And so what's the abbreviation for, if carbamoyl phosphate synthetase 1 is CPS1,
It's ASS1.
it's ASS1.
Is
So
that your favorite stain?
so at that meeting, at least 4 years ago, I said my favorite stain was argininosuccinate synthetase 1. And I have to tell you that all summer when we were optimizing this and running all these research slides, the lab techs, my lead tech, Ellen, she couldn't stop giggling. And actually, argininosuccinate synthetase 1 has utility. Like, it's emerged as a useful diagnostic marker
Right.
in the hepatic adenoma space. So ASS1 has traction. And I went to the USCAP meeting to present this this poster about all these different urea cycle enzymes, and I never got so many questions from other liver pathologists than my experience. Like, it was their favorite stain as well. I think it was my favorite stain and their favorite stain for very different reasons.
So moving on, what do you find is the most gratifying aspect of your job as a GI pathologist and as an IHC director?
That's a really hard question. I think I'm really fortunate to have chosen a career in which I'm able to honor my values. And the most gratifying part of my job, I don't know, it's, I'm fully engaged in the tripartite mission, and I get juice from all the different parts of my job. So I get excited when I make an awesome diagnosis. I get really excited when I make an awesome diagnosis and I order a stain, and then a few hours later, like that night or the next morning when I get the result, that it aligns with what I saw in the H&E. So like when the tumor that's an undifferentiated carcinoma with rhabdoid cytomorphology comes back and is in fact SMARCA4 BRG1 deficient, like, that's super gratifying. When I finally finish a paper that I've been working on for months and months and months, that's super gratifying. When it gets tons of traction on social media, that's super gratifying. When hundreds of people show up to hear me talk or to hear me host a monthly webinar for this ISOM that I mentioned, that's super gratifying. And then, hands down, the most important work that I do every day is in resident fellow education. And so when my extern Matt decides that he wants to do pathology, and he wants to do pathology residency at the University of Iowa, and then decides that he wants to be a GI pathologist, and then decides that he wants to be a GI pathologist that works on my team, it doesn't get any more gratifying than that.
Oh, wow.
What is the training like for this subspecialty?
What's GI fellowship like?
Yeah.
Yeah.
Yeah, I think that's a really good question. And I think that there's not one answer. And I I trained at UVA. There was no it's general sign out still. There was no subspecialty fellowship. I went to Ohio State, and so I can sort of comment on what that fellowship experience was like. And then I'm a fellowship director. So one of the identities I have is GI fellowship director here. And I can tell you about how our fellowship is. I can also give you some feedback from, folks that I interview for fellowship. And so my fellowship with Wendy was pretty loose. It was a new fellowship. I was the third fellow. And I think Wendy was really excited because I was super academic and super energetic and ambitious. And she really let me do whatever I wanted, frankly. Uh, so I could sign out or not. I could interact with the residents more or less. It was fun to like mentor junior residents. I would double scope cases with them or look at consults. Like they would consult me instead of another pathologist. But I did a ton of scholarship. I spent hours in the library every day. That's where I laid down my really dense knowledge in GI pathology. I was also going to Brigham, and I was so scared that I would fail that I studied harder than I had ever studied in my life. And then I showed up and I knew so much GI pathology that I might have known as much or more GI pathology than some other GI pathologist. I have a famously good memory. Uh, but I did a GI fellowship, and then I went to work at Brigham, and I did half GI and half general surg path. And so I reflected when I became a fellowship director, what in my GI fellowship prepared me for my future doing not just GI pathology. And I loved surgical pathology. And so even though I was doing a straight GI pathology fellowship, I took an active role in our frozen section service. They had this, they call it academic frozen section service. They have like a select group of folks that read all the frozens during the day at Ohio State. And it was these two older guys, Gary and Larry, and we hit it off personally too. And they could tell I was smart and could bail them out in a pinch. And so all year I looked at frozens, and that prepared me to do general surgical pathology. I also helped out in like a breast QA project, so I was fine. But I'm reflecting on, well, the median fellowship applicant and fellow in GI pathology, what is their first job going to look like? And it's exceedingly unlikely that it's going to be straight GI pathology. Even I don't do straight GI pathology, and I do more GI pathology than almost anybody that I know. You're either going to go into the community and do general and be the GI go-to, or you're going to work in academics, and you're likely going to work at a place that's subspecialized. I think the vast majority of academic departments are subspecialized, and you're going to get to do GI, but you're almost certainly going to have to do a second, if not a third area of subspecialization. And so when I built the GI pathology fellowship here in collaboration with the leaders of our like historically awesome general surgical pathology fellowship, we worked to synergize. And so my GI pathology fellowship is not 12 months of GI, it's 8 months of GI, and which is, in my opinion, more than enough
Mm.
to begin becoming an expert. Right, we're all
Mm.
lifelong learners, and 4 months of general surge path, and the general surge path fellowship has 4 1 month rotations, and they cycle through a few times over the course of the fellowship. So there's a hot seat where every slide except for derm and neuro and renal that comes out of histology goes to the hot seat first for preview by the hot seat fellow. So you get to see the entire breadth of surgical pathology and a huge number of cases, and you have to go
Mm.
really fast.
Right.
And then there's frozens where our surge path fellows read the frozens. They have a faculty backup, but it's faculty backup. Call if you
Mm.
need me. Otherwise, I'll be by every couple hours to sign off. So that like a frozen rotation with a lot of autonomy, but also like an umbilical cord that
Right.
can be used as much as needed.
Mm.
And then there's consults, and we have two different types of consults, just like everybody else. We call them outside slides cases, patients who've been referred to the cancer center, and we're just re-reviewing prior pathology. And then we get lots of directed consults, either to like Dear GI Pathology or Dear Dr. Bellizzi. So there's that rotation. And then there's a general fellow sign out rotation. So my GI pathology fellow does 8 months of GI, but they do 1 month each of each of those four general rotations. And then the general fellows, each of the four general fellows get to come to GI. I call it finishing school. They come in the spring. They come in February, March, April, and May. And a lot of them, after doing general surge, are going to work in the community. So we polish them up to work in the community. The
Mm.
the other thing that's really I think is really important is fellow sign out. And so my goal with my GI fellow is to get them ready for fellow sign out as soon as they're comfortable and as soon as my faculty is comfortable. Um, and then, the one thing that I took from Wendy was she gave me a lot of latitude in my fellowship because she saw that I had some unique characteristics and wanted us together to take advantage of those. And so, one thing that's really important to me in general, working with trainees, but I have the best opportunity to tailor it with my GI fellow, is to have a dialogue about what their goals are, what they want to get out of the fellowship, even what they want to get out of the week or the month. And that for my GI fellowship, it's not one size fits all. Each fellow's experience is tailored to the wants and needs of the fellow.
Mm.
So last year's fellow Abraham was incredibly like intellectually curious and research oriented and scholarly, and so we made time for him to do scholarship. We gave him an academic half day every week, whereas other fellows are much more clinically oriented, and they wanted to do as much fellow sign out as they wanted or as they could. Matt is the current fellow, and his career aspirations are, I told you he's going to stay on here, but he's very interested in education at all levels, medical student and resident. And so we're working with him to try to figure out how that's going to become an important part of his career.
Mm.
I guess, I say for every fellow that my responsibility is to get you a running start